extraordinarily pleased to introduce Linda, who is the President and COO of Feeding America. She brings a wealth of experience to this fight, to this hunger fight. She spent 25 years herself as the CEO of Food Lifeline in Seattle, which was an affiliate of Feeding America. And she brought that experience of actually working on the line, if you will, to Feeding America as its president and COO. I suspect most of you know about Feeding America, but those who don't, it is the largest charity working collaboratively with food banks, food pantries, and local food programs to help feed people today. And developing as well, not only focusing on the challenge today, but also long-term strategies that can be incorporated to end hunger in the future. Just to put a finer point on this, you've heard about the Iowa statistics and numbers, but just a reminder that 47 million of the people in this great country are currently food and nutrition insecure. And of that number, 14 million are children. And it's likely with recent actions with the reconciliation bill that the SNAP program may be impacted, which could put greater pressure obviously on food banks and pantries. Feeding America recently did a study that was impactful and informative here in Iowa, and it identified as a result of that study that 100% of our counties, all 99 counties, have reported recently an increase in food and nutrition insecurity, and I think Michelle Hussein mentioned that during her remarks. Just to give a greater understanding of the challenge and the need that food banks and pantries serve, over 50 million Americans take advantage of the opportunities that those food banks and pantries provide. And let me just say, for those who are here representing a food bank or a pantry, thank you for the work you do. I had the privilege of visiting a number of food banks and pantries during my time as secretary. And the work that's being done by the paid staff and as well by the extraordinary volunteers that are central to the work of food banks and pantries is truly inspiring. It's truly inspiring. And I had a particular opportunity to locate and to address those folks in the midst of disaster. And they deal with the challenge of hunger every single day, which is an extraordinary challenge, but then complicated by disasters. And Wendy mentioned the disaster here in Iowa, the hurricane or the tornadoes, but hurricanes and floods were pretty significant in the last couple of years, and that they still show up. In fact, I was in one food bank where their entire structure was hit, and within 24 hours, this was a massive, big city food bank. Within 24 hours, they had moved all of the food in that food bank to a different location. It was an extraordinary thing. It is really, there's just an amazing aspect of community that we sometimes take for granted. It never should. So we are fortunate to have somebody who's been on the front lines fighting hunger in this country and who's associated and affiliated with one of the great organizations in that fight. So please help me welcome Linda to the stage.
Well, good morning, everyone. I'd like to thank you. I want to thank you all for being here today, for lending your time, your energy, your expertise to one of the most critical conversations that we can have, not just in Iowa, but across the country and around the globe. I'd like to start by recognizing the urgency that brought us together. We gather not only as professionals, as advocates, as policymakers, but also as neighbors committed to building a more equitable food system here in Iowa and across the country and abroad. We gather because food is not optional. Food is fundamental. And yet, for far too many Iowans, for far too many people in this country, access to nutritious, affordable, and culturally appropriate food remains out of reach. My comments focus on the food insecurity landscape for young to middle-aged adults, the very people who often form the backbone of our communities. These are our parents, our caregivers, our farm workers and factory employees, our healthcare providers, teachers, small business owners, and often those who are working multiple part-time jobs to make ends meet. Now, when we talk about food insecurity in this group, we're talking about a silent struggle that plays out in break rooms and on factory floors. We're talking about parents skipping meals so that their children can eat. We're talking about people who earn too much to qualify for aid, but not enough to afford groceries after the rent and the gas and the childcare. Now, of course, this challenge has deepened with the passage of the budget reconciliation bill, and that bill will cause serious harm to working-age Iowans by reducing access to SNAP and Medicaid, two programs that are absolutely essential lifelines for individuals in this particular demographic. Let's be clear. SNAP is not just a benefit. It's a health intervention. It's an economic stabilizer, not just for the people who receive it, but for the grocers in whose stores those dollars are spent, and the communities that are supported by those grocers. And Medicaid? Medicaid ensures that people can work, parent, and live without having a major or minor illness turn into a major crisis. The recent cuts mean that thousands of Iowans will now find themselves on the edge or falling off. So what are the primary barriers to food security for this group? Policy changes. Cuts to SNAP and Medicaid will cause almost immediate disruptions. People will fall through the cracks due to complex recertification processes and work requirements that ignore the realities of low-wage, unpredictable employment. Shifting costs to states means states like Iowa will have to backfill expenses the federal government has historically shouldered. And I've come to understand that Iowa's fiscal 26 budget, the governor already had to dip into reserves to balance the budget. Wage stagnation, another cause for food insecurity. Many Iowans work full-time and still don't earn enough to afford food, let alone housing and transportation. In fact, this group is often overworked and undersupported. A lack of employer-sponsored benefits cause food insecurity. Many jobs in the service sector, including food service, caregiving, and agriculture, offer no benefits and unpredictable hours, making access to food support programs even more critical. Rural inaccess causes food insecurity. Food deserts and transportation barriers hit rural Iowans particularly hard. Without a car, a grocery trip can become an hours-long ordeal. And stigma. Many young and middle-aged adults avoid seeking help, as we heard this morning, due to shame. They internalize the false idea that needing help means they're a failure, rather than a reflection of systemic gaps. But we're not powerless, even in the face of these challenges, especially when we choose to act boldly. I'd like to talk both about some watch-outs and some opportunities. First, the watch-outs. The passage of the budget reconciliation bill means that annually 6 billion meals will be cut from the tables of people across this country. Now, to put that into perspective, the 250 plus food banks in the Feeding America network and the 60,000 pantries in our network last year in total distributed 6.6 billion meals. The passage of the budget reconciliation bill means that an amount of food the equivalent of the charitable food sector for an entire year was wiped off the table. Just going to let that sink in for a minute. In the face of a challenge like that, those of us who work particularly in food banking, but in the hunger relief sector writ large, we can sometimes tend to respond by immediately focusing on, where do I go get more food? How do I fill the gap? Let's be clear. The gap is 6 billion meals. This is not a gap we can close. And we shouldn't try. If we did, we'd go broke doing so. Will more people show up at our doorstep? Absolutely. Should we try and get some more food? 100%. But even at the height of the pandemic, when our network was receiving extraordinary support from the government, we were able to distribute 8 billion pounds of food. So even in the times when we were most able to boost our food supply, we were able to augment by 2 billion. We can't close that gap. And we shouldn't try. People Facing Hunger provided some really clear feedback to us at the Feeding America Network as we worked over the last year and a half to develop what we call a network strategic framework, a set of strategic priorities that our entire nation's food banks have decided to stand behind together so that we can be responsive to the needs and aspirations of neighbors as they told them to us. Now, here are some of the things that they told us. We don't know where to find the food. If we do find the food distribution, when we get there, sometimes we aren't treated in a dignified manner. And sometimes the food that we receive isn't appropriate for our culture, our traditions, our religious traditions, our dietary needs. They said, I want to be your active partner. Give me a seat at the table. I don't want to just be a recipient. I want to work alongside you because I understand this problem like no one else. They said, hunger is a symptom, not the root problem. Please understand that advocacy is important, but it's not enough to advocate for more food. It's important to advocate for the root causes of hunger. If we can solve those, I won't need food. And when you do advocate, include me. Let me raise my voice. Let me tell a lawmaker what my experience has been. And so now, let's shift from the watchouts and talk about what we can actually do, even in the face of the passage of the budget reconciliation bill, that will bring meaningful positive change for people experiencing hunger, that we can lean into deeply in every corner of this country. First, we have an opportunity to build new kinds of SNAP partnerships. The state agencies that administer this program have been handed some extraordinary challenges. We can stand alongside them. We can help them understand ways that they can address error rates as partners. They're going to be working to institute new workforce requirements. What if we used the extraordinary volunteer programs that we had as a way of providing community service eligible hours so that folks who are required to meet these new work requirements can come to our facilities and volunteer that required number of hours and meet that eligibility. That's already happening in several communities and states around the country. We can do it everywhere. We can expand community-based food solutions. We can support and fund mobile markets, food co-ops, and community-supported agriculture programs that accept SNAP. We can partner and expand programs with local farmers like I understand you have here in Iowa to offer produce boxes or farmers market tokens to adults not served by traditional aid programs. We can work to strengthen worker protections. We can advocate to state and local lawmakers and directly to our corporate partners for paid sick leave, for predictable schedules, for livable wages, so that people don't have to choose between work and wellness. We can integrate services. We can co-locate food pantries alongside job training, legal aid, and healthcare clinics so that we can serve people more holistically. We can make food distribution sites easier to find. There's an extraordinary technology organization in Chicago called Vivery, V-I-V-E-R-Y. If your state isn't partnering with Vivery, I want you to know that they can help make visible in your state every single food distribution site so that anyone who is facing hunger just needs to put in their zip code and the local food distribution sites will pop up. Vivery. We can boldly seek philanthropic support. The passage of this budget reconciliation bill means that we have renewed opportunity to talk to our donors about the need to give. Now, I've been doing this work since 1991, and if there is one thing that is true, it is that in every economic downturn, every single one, every time when there is a policy change that means more people stand in line at the food pantry, donors respond. That means we have an opportunity to talk about the impact of this bill and to ask donors to stand with us during what will certainly be challenging months ahead. We can work together to create statewide food security dashboards. And we know that many federal workers at the Census Bureau, including some of those responsible for the data collection that supports annual food insecurity estimates, these folks have already been laid off. And that means that there is a very real risk that food insecurity research could be lost. We could work together to create local food insecurity methodologies using locally available data to estimate and track food insecurity rates at the local level, to track program participation, to track service gaps. We know that real-time data can help us allocate resources more effectively. And we can support SNAP incentive programs. Double Up Food Bucks and other similar programs are proven to increase healthy food consumption among adults. So let's expand those initiatives. And finally, we can advocate together. I know that in this room, there are a wide variety of hunger relief organizations, and you all advocate. And you might advocate a little differently one from another. Some of you may have a voice that has the opportunity to lean more progressive. Some of you may have a voice that needs to stay a little more conservative or middle of the road. But what I want to tell you is that the most important thing that you can do right now is to stick together and to view that diversity not as a challenge or a problem, but as your superpower. You have the opportunity to plan together and strategize together who should take the lead in a conversation with a particular lawmaker. Who should be the person who is supporting and who should be the person who's leading the conversation. I think you'll find when you sit together, when you strategize together, when you use your voices together, you have far, far more in common than you have apart. Better together is a motto that we use in the Feeding America Network. And we mean it. We are better together, and you are too. And so with those things said, I just want to remind that Iowa is rich in resources. It is absolutely an agricultural powerhouse. And you are innovators, resilient, And yes, we can only call ourselves strong if we prevent our working adults from falling through the cracks of a broken safety net. And so to any lawmaker who is listening, bad policy got us into this, but good policy can get us out. And we will advocate for good policy. To every community leader, your programs save lives, and now is the time to double down on your commitment to your community. To every employer, fair wages, paid sick leave, and stable work hours matter. How can you put into place meaningful changes that could improve the lives of your workers? To every advocate, your voice is needed more than ever. And to every adult struggling with food insecurity, you're not invisible. You're not alone. You are the experts on this issue, and your voice matters. You are the leaders of this fight, and as advocates, we will not stop fighting with and alongside you until you thrive. Because food insecurity is not just about hunger. It's about power. It's about access. It's about whose well-being we prioritize and whose struggles we overlook. So today, I'm going to ask you, what kind of Iowa do you want to be? It is possible to build one, even in the face of the passage of this bill, where no one, no young adult, no working parent, no rural laborer is punished for needing help. It is still possible to build an Iowa where the promise of food, of health, and of dignity is a birthright and not a privilege. Okay. With those thoughts on the table, I'd love to answer any questions that you all have. I know there was a QR code at the beginning, and so I'll look to the folks at the back of the room to see if there are any questions that I can take.
Thank you so much, Linda. We have time for one question.
Okay.
So the question from the audience is, Map the Meal Gap shows rural counties are disproportionately affected with food insecurity. So what scalable, sustainable solutions is Feeding America exploring for rural Iowa communities?
Absolutely. Thank you. That's absolutely true. 90% of the counties in this nation with the highest food insecurity rate are rural. And we know that the challenges in rural communities are really different from those in suburban and urban areas. And it takes a lot of creativity to put forward programmatic approaches and ideas that can best meet the needs of folks in rural communities. The first thing that I want to say as a food banker, that might be surprising, is that I don't necessarily think that food banking is the most important strategy to meet the needs of folks in rural communities. The reach of programs like Universal School Meals goes further than the work that a food bank can do. The reach of a program like SNAP, for every 9 meals SNAP provides, food banking provides 1 meal, right? That's important, or at least it did before the passage of that bill. That's still significantly disproportionately different. So one thing that we can do is work really, really hard to ensure that people who are currently on SNAP get to keep SNAP, right? That's going to be really, really important. Now, when it comes to food banking programs, there are things that we know are really important. Providing mobile food pantries in communities where there's not a bricks and mortar food pantry, super important. Co-locating that food distribution by another social service, better. Working with your local grocery retailer and asking if you can put lockers outside their grocery stores, refrigerated lockers. In the Feeding America Network, we have an app called Order Ahead that neighbors can download, and they can use that to pre-order food from a particular distribution site, and they can choose the day and time that they want to go and pick that up. And so a food bank could start that kind of program and work with a local retailer to get those types of lockers outside a grocery store, so that on top of their grocery shopping, they're also able to pick up charitable food. We could also develop relationships with retailers who have the transportation programs. I heard Stacy talk about the delivery program that Hy-Vee has. What if we could work together on a program like that? What if the same truck could hold both the delivery to a neighbor from a food pantry and from the grocery store? So there are a variety of creative approaches that we need to be ready to think into when we talk about rural communities. So there's a few ideas for you. Okay, thanks very much for your time. Appreciate the opportunity to be with you today.